Hi, welcome back to Blood Talks. Today's topic is acid-fast stain. If you have been waiting for this topic, then thanks to this subscriber, he requested this topic a while back. So thank you for letting me know what you are interested in. And without further ado, let's get into it. In the laboratory, we use different types of stain to identify and group bacteria. These aid in patient care and treatment. The most commonly used stain in clinical laboratory is Gram stain. This type of stain uses the bacteria cell wall properties to distinguish between gram-positive and gram-negative bacteria. If you have interested in learning more about Gram stain, please check the description box for a link to that video. It would be so convenient if we can just use one stain to group and differentiate all bacteria, but it's not like that. There are bacteria that will not stain well with Gram stain, and we call this type of bacteria gram variables or acid-fast bacteria. The reason they are called gram variables is because they can be gram-positive and can also sometimes show as gram-negative. The reason that some of these bacteria can be differentiated using Gram stain is because they have mycolic acid in their cell wall. Mycolic acid is a waxy lipid component in the cell wall, and due to such property, it prevents the Gram stain from staining the bacteria properly. That's why we're having to learn and perform acid-fast stains. We are using acid-fast stains to group bacteria. We will be grouping bacteria into acid-fast bacteria and non-acid-fast bacteria. Procedures. Step 1. Prepare a smear in biological safety cabinet or hood and heat fix. Step 2. Leave the slide to cool down in the hood for about 15 minutes before staining. Step 3. Flood the smear with carbon fusion stain. Allow the stain to sit for 10 minutes. Step 4. Rinse gently but thoroughly with tap water. Step 5. Tilt and tap excess water out. Step 6. Flood the smear again with 3% acid alcohol and let it remain on the slide for 1 minute. Step 7. Tip the slide to remove acid alcohol. Step 8. Rinse gently but thoroughly again with water and tilt to drain excess water off. Step 9. Flood the smear with methylene blue for 1 minute. Step 10. Rinse gently with water and tilt to drain the excess water. Step 11. Place slides upright in a rack to air dry before reading. Step 12. Exam smear with oil immersions at 108 magnifications. Acid-fast bacteria should appear red, thin, slightly curved, possibly bent with taper ends against a blue background. The entire smear area must be examined before calling the smear negative. The methylene blue is stained the non-acid-fast bacteria, which is why the acid-fast bacteria appear red or pink. A common pathogen that use this type of stain to help identify is in the species of Mycobacteria. For instance, Mycobacterium tuberculosis, which cause tuberculosis, and Mycobacterium leprae, which cause leprosy. Thank you for staying with me until the end. What do you want to know next? Do you want to know more about blood bank, chemistry, or microbiology? If you have any burning questions, please feel free to leave me a comment down below. Lastly, if you have not done so, please like, share, subscribe, and click that notification bell. I will see you in the next episode of Blood Talks. And as always, remember, your blood tells you the story of your health. Thanks for watching. Bye!